My name is Michael Borlowski. I'm a junior at Eastern Oregon University. I'm doing a research paper on flexibility and mobility regimen within the sports performance industry.
My name is John Grabowski. I am the fitness director for ML. I've been training for about 25 years, whether coaching youth sports, running strength training programs for all ages, and here for the past 15 years along with the stretch.
Thanks for having me, Mike.
Nice.
Yeah.
All right, tell us a little about what you do.
Yeah.
Physical therapy.
I got my doctorate of physical therapy from University of Miami. Graduated in 2013, and I've spent most of my time in outpatient orthopedics, working with a wide range of people from mostly like high school all the way up to into the 90s. So dealing with a lot of different issues, but flexibility and mobility is important in all age groups.
The community health concern that impacts early childhood athletics through adult athletics is the lack of a usable mobility and flexibility training guide to avoid injuries. For example, a unified injury preventative protocol to mitigate kinetic chain injuries for athletes who play their respective sport should be addressed throughout the athletic industry. Flexibility and mobility in performance sports should focus on overarching routines that address specific sports. However, research shows that a broad framework across all levels of play and diverse sports all would benefit from a system-wide flexibility and training regimen. The impact of a strategic and lifelong systematic flexibility and mobility performance routine on the human movement system will affect how athletes practice, compete, and recover. In short, without proper direction and implementation at all levels of play, injuries that may have been preventable will continue to happen. Parties that will benefit from a top-down flexibility and mobility framework to be used in day-to-day sporting events will undoubtedly be athletes. Nevertheless, the benefits reached to include coaches, parents, and guardians whose children are athletes, athletic departments and school systems, professional and semi-professional sports organizations and associations, collegiate sports and associations, doctors, trainers, and any stakeholder who has a link into the world of athletic performance. This research paper will highlight the specific concerns, such as whether this is a communicable or non-communicable problem, who and how are affected, example, national, state, and community level, risk factors including social, emotional, mental, and financial. The paper will also touch on what is currently being done to fix this public health burden, current interventions, and the best path to take to solve this threat. Addressing the epidemic of non-contact injuries caused by the lack of a systematic flexibility and mobility performance regimen requires a unified approach. Therefore, stakeholders must adopt a systematic model of specifically tailored mobility and flexibility conditioning to preserve the musculoskeletal health of athletes across the entire developmental spectrum. Before reading through this paper, it is important to fully understand what defines flexibility, mobility, and injury within the context of the human movement system and in sports performance. Flexibility is commonly defined as the normal extensibility, ability to stretch, of all tissues, contractile or non-contractile, and that allow the complete range of motion of a joint. Flexibility is having the option amount of extensibility in the fascia and muscular systems to adequately perform a physical task. With this also comes a necessary amount of tension in the systems to maintain alignment and balance. Mobility is defined as the range of motion in a joint or series of joints, and from a functional perspective, represents the ability to move comfortably without constraints or pain through a full range of motion. Injury, as defined by the International Olympic Committee, is tissue damage or other derangement of normal physical function due to participation in sports, resulting from a rapid or repetitive transfer of kinetic energy.
So to me, mobility would be able to safely move throughout the range of motion of the joints.
Okay.
I don't know what the textbook says, but that's what my brain says.
Yeah.
So I'm part of from the textbooks. But and flexibility is more thinking about the length tension of that muscle and its ability to have the excursion necessary to go through the range of motion of the joint. So if my lats are tight and shortened, then it's going to limit my shoulder flexion. Even if my joint has the capability and mobility to get through the range, that muscle tightness is going to limit it. So that's where we're working on flexibility, and that's where I think flexibility and strength really go hand in hand, and that would help get my full mobility. Now, I may have shoulder arthritis, and now I've lost space, and so the ball can't move as freely, and it may truly just be the joint arthrokinematics that are limiting me from getting through that range, and that's where it's then I'm not going to be able to get right. So you can kind of feel, and especially when you're working on a joint, you feel the end feel of the joint. It gives you an idea of what's limiting.
Do you believe that Just everybody should be doing some sort of flexibility and mobility training with their
Motion is lotion.
Motion is lotion. I like that.
Distinctly.
The objective of this paper is to give a stakeholder the call to action to implement with urgency a system-wide injury prevention framework that at its core utilizes a mobility and flexibility routine that hits 5 kinetic chain points within the human body that can be used across all sports and at all levels of play to avoid non-contact injuries. These non-contact injuries are non-communicable and impact each developmental stage of play. The consequences for not addressing this concern within the ecosystem of sports performance are many, and the concern that first comes to mind is physical ramifications thereof. Of the 5 kinetic chain points that are impacted the most by non-contact injuries among the whole athletic developmental spectrum, 3 show a reoccurring theme, which are hip lumbar pelvic complex, thoracic shoulder complex, and knee complex injuries. To discuss in order, hip and groin injury, also known as HAGI, which is a non-communicable musculoskeletal injury often stemming from repetitive mechanical stress, also known as strain, tendinopathy, and joint stress. HAGI is defined as adductor, pubic, inguinal, iliopsoas, or hip-related groin pain. HAGI involves numerous structures, for instance, adductor musculature, iliopsoas, rector femoris, bular laborum, and pubic symphysis, highlighting its complex, regionally independent nature. Identification and management of hip and groin injury can be challenging as numerous structures within the region can be drivers of pain and injury, especially when considering the likelihood of concurrent pathology and injury reoccurrence. Another area close to the pelvic complex is the lumbar portion of the body, which has been found to impact youth at a considerable rate as well. Postural misalignments, thoracic kyphosis, and lumbar lordosis combined with muscle imbalances can compromise skeletal and soft tissue structures, which include fascia, muscles, ligaments, tendons. Tight hamstrings, iliopsoas, and quadriceps are consistently associated with back pain in youth. For example, research found that in elementary softball players with tight quads had higher odds of back pain. And that's not all. Similarly, reduced finger-to-floor distance has been linked to children aged between 6 and 12 with back pain, highlighting that this lack of correct posture directly correlates to postural misalignment. Most students exceed the recommended workplace limit for adults, 10% of the body weight, leading to discomfort and compensatory postures. Excessive sedentary behavior, poor lifting techniques, and asymmetrical backpack use increase susceptibility to back pain. Trunk muscle endurance, sagittal spinal alignment, spinal mobility, and neurodynamic assessments have also been identifiable factors leading to adolescent back pain. Decreased trunk muscular endurance, both in flexor and extensor muscles, have also been associated with the presence of low back pain. This is affecting both sexes as well. According to research, boys have shown tendency to have greater thoracic kyphosis, also known as hunchback, tighter hamstrings, and reduced hip extension. They need flexibility work focused on hamstrings and hip flexors. Girls tend to have greater lumbar lordosis, swayback, and better flexibility, but may need different trunk conditioning emphasis. In the fitness postural assessment, boys presented greater thoracic kyphosis across all evaluated positions. In contrast, girls exhibited greater lumbar lordosis in the SP and less lumbar kyphosis, along with a more neutral pelvic position in both the SSP and forward bending tests, which may reflect sex-related differences in spinal alignment development. In terms of range of motions, girls consistently showed a greater range in all tests performed, which may be related to different alignments of the spine. Finally, in the trunk muscle endurance test, boys demonstrated higher endurance in the lateral flexor muscles, whereas girls performed better in trunk extensor test. These patterns highlight potential differences in functional core stabilization strategies between sexes. These issues lead to functional disturbances that increase the risk of back and peripheral joint injuries, not only in youth from as young as 6 years old, but throughout the life of an individual. HAGI is reported as 5 to 10% of injuries across multiple sports. In high-risk sports, lumbar pelvic complex injuries accounts for 10 to 23% of all injury time loss. A systematic framework to address issues for both sexes should be a key benchmark in physical education. However, the focused prevention strategies have been suggested, but their practical clinical implementation has not been heavily investigated across the sporting spectrum. If a streamlined flexibility and mobility regimen that is used across our sports community and local, state, and federal systems, the noted anatomy may be accordingly impacted by sprain, strain, tendinopathy, bony and joint stress, osteoarthritis, or a combination of pathologies such as osteoarthritis and labral degeneration.
Hang out in a little bit of an anterior pelvic tilt or forward flex. So even with your gait, if you're walking, well, then your glutes are consistently lengthened. So we can't recruit. You can't get as much strength out of them as if you were in an upright posture. So same thing if the muscle is really tight. Sometimes if say that some of those hip muscles, the rotator, they get very, very tight because either from overuse and overcompensating for another muscle or because they themselves are weak. Then it's hard for us to fully access them. So that's where working on, mobility and flexibility is super great. But if we say that you have tight hamstrings and you do mobility flexibility training all day, but really the cause it could be maybe just a weakness somewhere else, we're probably never going to fix the problem. So it's kind of, I don't think you can just say one is more important than the other. It's kind of addressing all of it.
That I do is our body is also not even this the kinetic chain. as we look at it as a NASM stretch coach, is our body is made up of muscle nets that connect all the way from your left ankle to your right shoulder, all the way up to the right side of it, kind of idea. So as those folks are about seeing these imbalances and these lack of mobility or lack of flexibility within certain areas, I'm going to understand that there is a nuance that now is going on throughout the entire chain of that net, whether it be.
And for those who don't know, Michael Sure. Fascia nets is what he's talking about. They connect throughout the whole muscular system, and it's called a fascia system. And that's beyond the scope of this research paper, but I just wanted to let you know for intensive terminology purposes.
So the fascia system, along with being connected with the muscular system, all have that whole like kinetic movement, kinetic chain idea. So coming back to your point, which can you repeat? Sorry, I got into that part for a second.
How can mobility and flexibility, we were talking specifically about the hip and the pelvic complex.
Okay, so the scope of it all. So when we're working with those types of things, when it talks about specifically there, we're trying to generate the whole body to make sure that the posture, like I mentioned earlier, is there. Because if I can be able to work not only with the imbalances in those areas, but along with the upper posture muscles there, we're beginning to play directly and indirectly with that position of the hip and the pelvis. So we can get rid of the forward toe. We can strengthen the upper body to be able to put itself where it should be. In lack of an educated academic term, is if we're in here a little bit, and if we can begin to get those posture muscles to do their job. I was using the term earlier today about making sure that your suspenders are tight in the front and the back. So if you've all seen their grandfather with loose suspenders, they're all loose in the back. We're here to make sure that our posture is tight, which can begin to then, as you're getting into motion, begin to help even with a very, very passive correction of their hip and their pelvis and their gait. Because now we're not dealing with forward lean or kyphosis or any of those types of things that might placate on an all-day affair with their bodies going through. And then we're here with our exercises approach to fix those as well. So we're coming from both sides, directly and indirectly, to that imbalance or complexes of lack of mobility.
The repetitive nature of some sports can result in higher indices of shoulder injuries in individual sports. Evidence suggesting that decreased range of motion is a risk factor for injury in young athletes. For example, adolescent swimmers with limited range of motion were found to have 3.6 times higher risk of developing shoulder pain than swimmers with normal range of motion. Upper limb injuries contribute up to 21.4% of all injuries sustained during practice in a variety of team sports, with indices up to 91% of shoulder injuries occurring in elite swimmers. What does this all mean? Shoulder injuries can cause significant dysfunction and disability in sports with high recurring upper limb loads. Research shows that the thoracic shoulder complex, though a vital kinetic chain point, lacks analysis overall compared to other kinetic chain points that impact the human movement system. Research for the knee complex in particular was easier to find than the shoulder complex. Though both injuries lead to players being put into injury protocols that limit their playtime, the limited research resources spent on shoulder injury prevention are currently deemed unfounded and unjustified compared to the disproportionate focus on the lower limb. An ACL injury has an incident rate of 2.110 per 10,000 athletic exposures for contact sports and 0.36 per 10,000 athletic exposures for non-contact sports. Even in higher risk sports, only 1 out of 80 athletes sustain an injury to the ACL. The number of injuries to upper limbs is lower than that of lower limbs, which at face value justify disproportionate publications. However, according to Stewart and Oliver, there exists a clear need for a specific review on shoulder injury prevention, and that limited research resources spent on shoulder injury prevention seems unfounded. The third kinetic chain point that this paper covers is the knee complex. Running-related injuries, RRI, are a non-chemical musculoskeletal concern. What defines RRI? Running-related injury is defined by at least one of the following: diagnosed by a medical physician, athletic trainer, or physical therapist. 2, presence of pain with duration of symptoms lasting longer than 24 hours. 3, decreased running mileage. Or 4, missed workouts. Lower extremity is defined as an anatomic structure caudal to the lumbar spine. Recreational runners, impacted up to 94%, and athletes across the developmental spectrum are all affected by RRI. Injury in runners is common, affecting 19.4 to 94.4% of runners annually. A high incidence of lower extremity running injuries such as Achilles tendinopathy, anterior and or lateral knee pain, hamstring injury, stress fractures, or medial tibial stress syndrome is reported commonly in scientific literature. Despite widespread research on running injuries and their treatment, there are few long-term strategies or guidelines for preventing injuries in runners.
Thinking about a runner, it's very common to talk about glute med strength in runners, and if they don't have enough, that's basically what helps stabilize your pelvis, because when you're running, you're on one foot for a period of time, and that's going to help stabilize that pelvis. And if that doesn't have the strength, well, then we might even collapse in. We might get some stress on the medial knee, or so the strength component is super important to allow our body to function through that full range.
After the identification and examination of the cause of our non-chemical physical problem affecting athletes' 3 kinetic chain points of the human movement system, it is important to incorporate other factors. Included in this paper are social, emotional, mental, and financial. These not only affect athletes, but the additional listed factors also reach throughout various levels within society. These include local communities, states, and the country. Injury produces a physical, psychological, performance, and financial fallout that requires management over several seasons. There is also a performance impact. Athletes who sustain more than one injury requiring a modification of over 20% of their training weeks experience a 65% reduction in the achievement of their performance goals. Certain public health and economic burdens exist in this discussion as well. The injury results in a chain reaction that requires management over several seasons, indicating high long-term financial and physical management costs. In order to prevent sporting injuries, contemporary research advocates for primary injury reduction strategies such as rule adaptation, neuromuscular training, and equipment modification for at-risk populations, particularly active youth and adolescents. Prevention is better than cure in breaking the chain reaction that develops as a sequela of injury, according to Stewart and Oliver. So why does the problem persist throughout the sports performance industry and along the developmental spectrum? The culture and history of each individual sport presents varying attitudes and opportunities in cultivating and prioritizing the development of research practices. This in turn leads to suboptimal pre-season training and congested in-season competition, minimizing physiological recovery, which magnifies existing risk factors regardless of physical capacity. From looking at the granule problem, researchers have begun to notice how this impacts the clinical and community levels. The lack of community access to the most advanced assessment tools such as 3D analysis are not regularly used by clinicians due to time and expense, limiting the accessibility of high-quality screening in community-based settings. The focus of who gets studied is also a social determinant. Studies often exclude military studies as running conditions, example footwear and carrying load, are usually different from recreation or competitive runners that would be seen in community-based settings, reinforcing the lack of data generalizable to the average person. There is also a biological rationale for focusing on childhood. It is that there is increased pliability and reduced muscular tendinosis, stiffness during this period, enabling greater range of motion to be attained, making flexibility training more effective. According to Martinez-Romero, empathy is also a factor highlighting the emotional mental connection as to why a unified approach has not been formulated. In his research, he explains that young children and adolescents have been let down by the health education system when it comes to the health of their backs. Specifically speaking, health education is needed to address sitting habits during studying and mobile device use. Students are not just slouching, they are battling anatomical changes and environmental loads leading to discomfort and compensatory postures. Additionally, at the state and federal levels, clinicians throughout their states and around the country are not inputting metadata of their findings into a secure system to generate proper systematic flexibility and mobility routine. It's if siloing has been taken to a whole new level, which impacts all of us. Clinicians often use objective assessments to determine alterations in muscular strength, muscle flexibility, joint range of motion, and alignment during evaluation of runners. They rely on results of single studies reporting individual tests or cross-sectional designs, which are scientifically weak for prediction. Kinematic measurements, examples running gait analysis, are being investigated but are not regularly used by clinicians due to time and expense.
You're teaching their children or teaching children in general. Do you find that throughout different sports that there are specific or just a general range of motions that can tie all those sports together? That, let's say, if they're doing swimming, if they're doing cycling, if they're doing ninja, if they're doing basketball, right? If they're hitting their whole, human movement system, can now you say, okay, this is a good way to where you're going to hit all those ranges of motion, all those joint ranges of motion, and now you base off like a stretch routine for all of those. Do you think that is something that the educational system, or at least within, athletic departments in schools, should have?
I think we're sitting with them already here, because if you go to any soccer field or if you go to a basketball game or you go to any of another, we'll now draw into high school sports in terms of into high school sports, right? And in the college, we'll notice more and more that they are doing movements that we will see with our clients in terms of what I like to call mobility drills and flexibility that get us ready for movement. So when I'll get to the landing of the programming, but the more often that we can see those go across exercise or sport lines, the more we understand that program can be honed in. And so where I'm getting at is when we work with athletes and see them on the field, either doing toe touches or they're doing mobility drills in and out, open door, closed door with their hips, depending on the sport or depending on the level of play. Those are a generalized type of thing. Let's go with open gait mobility and closed gait mobility type movement. Depending on the sport or depending on the age of the team, that mobility could be there. The nuances of the open gait and closed gait, meaning how often, how fast, how long, can be modified. So that particular motion that they might have learned at 7 and 8 in their travel teams and whatnot, where they're just still introducing them to stay moving and flexibility and mobility, is underneath there. So their subconscious can understand, like, I know open and closed gait. Now as us as athletic professionals, coaches, and those departments need to incorporate what is the next step of that movement to generate now these new explosive movements into these bigger, better, faster, stronger athletes. Thus coming back to the duration of that mobility, the challenge of that mobility, the speed of that mobility, because that doesn't change from when they're little trying to kick a soccer ball to being big kicking a soccer ball. But now we're just working with a bigger, better, faster, stronger athlete. And understanding as they've grown into that range of motion and mobility has changed to maturity. And we need to work on the idea that how do we incorporate them still being fluid and mobile in that route. I've seen that.
What are current interventions and goals addressing this epidemic? Within the scope of youth and adolescent athletes, most long-term athlete development models encourage participation in mobility and flexibility training from a very young age, 4 to 5. This is based on the underlying assumption that flexibility can be enhanced more with early training, the window of opportunity concept for ages 6 to 11.
Over our time to understand, coming to your last, rounding in your last questions, windows of opportunity. 4 to 7, have fun, be involved, start to mold them into understanding that any kind of physical movement is fun. 7 to 11, where are they starting to watch? What are their friends are about? What are we influencing them? Still general movement. And then as they get into, when they grow into themselves a little bit in that 12, 16 range, is when other windows of opportunity specifically towards sport is good. And that will incorporate also our idea that as we brought them along, we have talked about these mobility and flexibility things that have kind of come along in the background. Right. That going back all the way into my open gate, closed gate idea, or that.
Past research in adults has reported that total stretch duration is more important for range of motion enhancement than the duration of each stretching bout. Cross-sectional studies in adults also reported that higher stretching volume load, example, the total duration of stretching applied over the intervention period, is a crucial factor for improvement in range of motion. However, evidence for the effects of stretch training on range of motion improvement in children and adolescents is limited and in many cases contradictory. Therefore, short-term stretch training improvements in joint range of motion are usually attributed to increased stretch tolerance and or related to decreased tissue resistance to stretch. Flexibility is a large, under-researched area of study within the pediatric populations. It has been suggested that childhood is a key period for flexibility development, with the age range of 6 to 11 years proposed as being a window of opportunity for flexibility development. So what is the research verdict of the primary intervention? According to Dante, stretching interventions were moderately effective in increasing range of motion in both children 6 to 11 years and adolescents 12 to 18 years. Which his analysis suggests that a window of opportunity for flexibility development during childhood, which has been widely suggested in literature, is not evident, and flexibility can be developed throughout childhood and adolescence. In other words, confounding variables such as the loading characteristics of stretching protocols has not yet been collectively assessed. Martinez-Romero proposes his solution, postural fitness, through the adoption of a screening protocol that is integrative. He also provides guidelines that stakeholders can follow to address the postural problem among young people. He and his team believe that adopting an integrative construct called postural fitness to maintain musculoskeletal health, flexibility, and muscular endurance is paramount to the human movement system and the impact of kinetic chain point. Not mentioned in my intro was I went to school for elementary education for most of the time for physical education. So the idea of young kids and movement was at the beginning stages of my kind of training career. And I preface that also that I also have a 12 and a 9-year-old at home that I'm constantly trying to help move. So not only in the background, but in the foreground. But coming to it, I think that when it comes to kids and movement, especially when we're talking about of age to go to school, so we're talking about that 4 to 7 range when they're coming into their first ones. I think it's important for all of us, not only as professionals, parents, and influencers on these kids when it comes to flexibility and mobility, that we need to draw back the idea of specificity. And we need to draw in the idea for them to be curious, excited, and involved in being in movement, because it's the mobility part, right? They're like little balls of clay right now. They're Gumby-ish. That's why they're allowed to fall, and somehow you thought they're going to get hurt and they spring back up. But the idea there is for them to be curious and have fun with some of the things that we'll do with them, of them running around or them sitting down and just playing a game with them to reach for their toes. We need to have it where we're instilling the curiosity and the excitement to be involved in physical activity, albeit mobility and flexibility. And as we grow them up into this curiosity and this excitement and this involvement into their life of movement, we'll be able to draw in some specifics. Basically, in my terms, when it comes to training, is I begin to sharpen the pencil more and more. Right now, we're just trying to get them involved, get them going and move, then sharpen the pencil a little bit, meaning getting more specific, sharpen the pencil a bit more, and even more specific as they get older, as their interests are being shown in one way or the other, whether it be a specific sport or multiple sports or sometimes no sport. I mean, both of my children did Junior Ninja, which Ninja Challenge, which is what you see on TV with those guys jumping, running, leaping, and whatnot, which I thought was great for their dexterity at a young age. From 5, they did it. Both of them did it for off and on for 3-4 years, and it had to do with all of these movements, which I felt like in my generation we gained from playing outside, and we got from doing all of those recreational soccers, baseballs, footballs, that with all the other ways to go for movement, we can really be able to navigate things with their curiosity and what they're excited about. Instead of being, the kid that's out there playing soccer and we think they're getting mobility, but they're more chasing ladybugs and looking at the butterflies. You know what I mean? Which is great. And so we're able to have these avenues, and my children specifically felt a really gravitational pull towards it. And I brought it to them because if you want some of that movement, that's got almost all of that incorporated, and they stick with it all the way through, the next phase of where it is, that's kind of what we've seen academically, there's that 6 to 11 group, where they're starting to be able to put it together, the background of understanding the maturity of their movement. Even though they might be 10 years old, they might, I guess, in their eyes see they're still, their mobility and their physicality is still immature, comparative to a 10-year-old that just seems to move fluid, right? And sometimes it's very egregious at that age to see that their mobility difference comparative to one, what we would see normally in my generation, be the one that's running around with a soccer ball, dominating the soccer game, and the kid that might even still be chasing behind him, but just can't catch up to his movement, right? And so that's where when we come to that group, that we want to be able to just, like I used that term before, sharpen the pencil a little bit more. Play, still in play, still in mobility fun. That has to do with all of a sudden drawing upon directing our ideas and specifically towards that movement pattern, improving. I'm still not going to specifically isolate them into movements that I would do with a team.
and whatnot, because remember, our physicality maturity might not still be there.
Okay.
Their interest is there, but I might be still working with interest to try, like, I really want to catch up to him, but we still see the physicality, whether it just be by height, bone density, strength, weight, specifically at that age is really the weight type of deal. So summing that up as we grow into that stage into the adolescence one, I really think that being able to make sure to keep them engaged, curious, and excited about movement, and as for us as professionals, putting it into that spot, how can we curtail that in to where they are, whether it's generally moving around and being excited about play and doing things, and then they get into that 8 to 11-year-olds where all of a sudden it's still play, but we're navigating into areas competitiveness, and then all of a sudden some of our like play and drills have some background specifically because now they're trying to perform that movement over here, and all of a sudden we're doing something different that looks fun, but it's still incorporating very similar movements, doing something else. So they're sparking because their attention span and curiosity is being gone through competitiveness and challenge and fun. And then as they get into teens, one, the maturity level starts to grow not only physically but mentally. Their desire to try to compete, if it is competition for them, grows. So they do see some of the nuance of change much more in their eyes and their focus. And if they're not into that point in time where they're just wanting, they're still piqued in curiosity to be active, then we still can navigate them towards being active and still keep it in the ideas of having it be fun, whether it's just swimming at home and being able to swim all summer long and they love to do it so they swim more, or they're out and they're taking their dogs for the walk and they're riding their bike and they're keeping that incorporated instead of all of a sudden now we haven't introduced even those type of activities because we've just driven towards straight standardized sport. So even my sport kids, I would still want riding bikes, hiking, swimming, given the fact that those are great movements for them to always have because they're outside of just playing. Now we're 13, I just want to play soccer all the time. And then sometimes we realize at 12 years old, like my son, that he loves to do ninja, but now it's kind of getting a little bit boring for him, but we've incorporated a lot of movement in swimming and biking and riding. So I know as he grows older, there's still a passion and an idea that movement is important.
Spinal misalignment may contribute to back pain symptoms if not addressed, he stresses, and identifying these deficits early is valuable for implementing preventative strategies in school and sports contexts. He proposes a systematic test battery assessing spinal alignment, flexibility, mobility, and trunk muscle endurance. Therefore, screening protocols that integrate postural evaluation with functional tests may improve early detections of at-risk individuals. His intervention strategies rely on precise screening mechanisms, move beyond questionnaires to physical testing, using the postural fitness protocol for early detection of at-risk youth. Understanding how these variables interact with growth, maturity, and sex can enhance the prevention and management of musculoskeletal conditions in youth. Preventative interventions focusing on physical, behavioral, and environmental factors can lead to a dual purpose, reducing current discomfort and fostering healthier habits during critical developments. Furthermore, psychosocial and lifestyle factors, such as screen time, backpack load, and quality of life, may also benefit from proper postural fitness. For instance, incorporating training program focused on health and postural awareness can help promote healthier sitting habits during studying, watching TV, or using mobile devices, and reduce discomfort associated with carrying heavy backpacks. This is particularly relevant given that most students exceed the recommended workplace limit for adults, generally set at 10% of body weight. His team takes this protocol a step further throughout the programming. They believe that implementation of physical therapy programs, including postural training, stretching, and sensory motor exercises in combination with already used school-based initiatives will benefit students and young athletes. The combination of ergonomic education, flexibility training, and core strengthening can be particularly effective. This aligns with evidence supporting the effectiveness of physical therapy programs in reducing back pain prevalence and improving postural health in children and adolescents. His last argument to support postural fitness is for youth to engage in corrective dance or movement games to make the boring work of posture correction engaging for youth. Functional and engaging modalities such as corrective dance or movement games have shown promising outcomes, especially for adolescent girls with thoracic hyperkyphosis. Dancing has also been found to improve mobility. More specifically, in the core, and unlike Martinez-Romero, Scopel looked at how dance impacted the whole athletic developmental spectrum. Exercise movement techniques such as yoga, Pilates, and dance exercises are a cross-training option as well for more traditional methods such as dynamic stretching. Exercises relevant to the movement patterns of the sport are recommended for transferring to sports performance. Monitoring range of motion changes throughout the program will be important to ensure its effectiveness. Dance and gymnastics are two disciplines which require high levels of range of motion for the performance of technical skills. Therefore, exercises from these disciplines may assist in developing mobility for other sports. Structured dance interventions have been shown to be effective in improving functional movement capacity in a range of populations, and this benefit may extend to athletes who have greater movement demands than the average population. Gymnastics is a recommended fundamental sport for all junior athletes. However, its potential to enhance athletic performance in adult athletes has also been explored in dance populations. Its potential to enhance athletic performance in adult athletes has only been explored in dance populations. Many of the mobility protocols, especially the yoga and Pilates interventions, included a range of spine mobilizations through flexion, extension, and rotation. Optimal spine mobility, particularly of the thoracic spine, allows an athlete to maximize force transfer through the kinetic chain. Dynamic stretching is recommended as pre-performance routine in most sports because of the demonstrated small acute increase in power, sprint, jump, and balance performance. Dynamic stretching is defined by controlled movement through the active range of motion for each joint. Higher stretching volume loads result in larger range of motion gains only in children and not in adolescents. Setting goals for a systematic model childhood, ages 6 to 11, training focus should be on higher stretch volume loads to maximize range of motion gains, capitalizing on the higher pliability of muscular tendinous tissues. It was found that stretching interventions were moderately effective in increasing range of motion. In particular, the results showed that stretching was moderately effective in increasing range of motion in children and adolescents. Adolescents ages 12 through 18, training focus shifts to maintenance of previously acquired levels of flexibility. Higher volume loads may not be necessary or effective due to rapid bone growth, reducing muscle tendon extensibility. When addressing the developmental spectrum, range of motion adaptation is slow. Studies in the high volume group had a training duration of 9.5 weeks. Flexibility is a fitness component that is improved slowly, suggesting a need for long-term stretching protocols applied throughout childhood and adolescence. Results in Dante's research found that after all the participants have been analyzed together, lower stretching volume loads, less than 3,600 seconds, increased range of motion in the experimental groups compared with the age-matched controls, and the same was found for higher stretching volume loads. Of the subgroup analysis in children under 11 years old showed that both lower 3,600 seconds and higher greater than 3,600 seconds stretching volume loads were effective in increasing range of motion in the experimental groups compared with the controls. However, higher stretching volume loads were more effective in increasing range of motion during childhood compared with lower stretching volume loads, meaning that the subgroup analysis in adolescents greater than 12 years of age showed that both screening volume loads, example lower than 3,600 and higher or greater than 3,600, were effective in increasing range of motion in the experimental groups compared with the higher stretching volume loads. The interaction of age and stretching volume load suggests that there may be a window of opportunity during early childhood for flexibility development, provided that the stretching volume load is more than 3,600s. In contrast, the lack of a stretching volume load in adolescence is likely due to faster linear growth of bones compared with muscles, which reduces muscle tendon extensibility and induces substantial range of motion limitations.
At that particular, like we'll use the window of opportunity, like that's basically the introduction of physical movement, whether it be sport or conventional or unconventional exercising and movement. I think it's just important for them to be introduced to a bunch of that and to find all those different movements. But the other one is just the curiosity and the fun and the engagement for them at we'll use the 4 to 7 week, like where they're just always having fun. They want to have more opportunities to try to do whatever we're introducing them to, especially since they have all those new spaces to show us where their maturity is without any of this being, meaning that the Jonathan Yes and the Mike McNull idea is the idea that we have such a long spectrum of opportunity for that to both be yeses, that the important part for there is to not turn them off to wanting to have fun and exercise and move, because that could be the next phase of the idea of having a conversation of them being getting a negative perception of some type of exercise and movement. It's weird to say that a 4-year-old could come to that conclusion. But the idea of constantly having anyone do anything over and over again and showing a disinterest in it is going to be it will develop a complex towards anything. Think outside the scope of exercise and movement. If you overstimulate a young individual or anybody into reading, as soon as you're not in front of them, it's the last thing they're going to want to do. The last thing they're going to do. You want to get it. So going back to that these kids, when they are into the next phase, the 7 to 11, the 11 to 16, that all of a sudden you find them in the yard and more importantly, independently pursuing movement. And then obviously as we guide them as the professionals, molding that play into when they are independently or with you, the specificity of the movements are enhanced, creating both of them to be a yes. So I think if we're talking about windows of opportunity for 47, it's the windows of opportunity, kind of not to screw it up. We are there to have them have fun, be involved, move. So then when we get to the next one, we are incorporating things that obviously their bodies are blowing up, whether it's no, they're not ready for that in terms of that movement or yes, we're still providing opportunity for them to try. Right. And so then when we're there, it is, and you can incorporate it as athletes and as professionals otherwise, we want the stimulus to stay there in a positive direction, because we know over time, especially in sports, we've seen late blooming sport athletes, and we've seen the sport athlete that was doing it from 7 to 30. Okay? And at points in times, we've seen them playing on the same team, generating the same exact stats, accolades, and accomplishments. So we can't automatically take Michael as a no and just put him on the shelf. Right. We just want to make sure that we're creating more and more opportunity for Michael to find his avenue as it goes along, that movements incorporate, because you never know when that stimulus is going to occur for them to be interested in a specific sport. Right. Coming from someone that did not play travel sports, did play rec, but was never part of like a travel team or we'll call an elite team or select team until I was into high school. But when I was into high school, by the time I was going, I was on varsity. Compared it to other individuals that would be on a team that were playing soccer or basketball in those select U11, U9 groups, all the way from that time. There is always an opportunity in there for that individual to grow into those and get onto those teams.
Within the scope of interventions and goals addressing hip pelvic lumbar complex amongst the whole athletic developmental spectrum, hip mobility can also be optimized from Pilates, which typically includes active movements through hip flexion, extension, abduction, rotation, and circumduction.
We'll look at, so like I said, we'll take the hip joint through its active and passive range, we'll take the knee joint through active and passive, we'll look at lumbar active and passive. Then we'll look even at hamstring length. So when I would passively lift it and see, and also with the hamstring, that's a tricky one. You could bring in some neural tension, which could be something else that could possibly be limiting the range. And then we'll look through, strength testing, manual muscle testing. A lot of times people are strong enough. I mean, depends on the client, but that is a little bit subjective. It's time pressing. So if we were to test the same person, the pressure release might be a little different. But after we look at a basic strength test, then there are, I kind of draw from different models, and I'll look at, I look at first just to sit to stand in a basic squat, right? And then if they can do that, then I'm going to look at a single leg sit to stand and just progress until we find where there's a breakdown. When
Evidence found deep squat depth improves in athletes completing Pilates before weight training. Core strength or endurance would also be expected to improve following Pilates. However, this outcome measure was not included in the Pilates study's review. It was, however, shown to improve with yoga. Referencing back to Short's research reducing Hagi, it is best served by focusing on global neuromuscular training combined with individualized and context-specific prevention programs that avoid training load error. His research stresses intervention over identification. A general, well-planned, balanced, and executed multi-component exercise training program may be protective regardless of individual risk factors. He proposes that as opposed to a narrow-focused or isolated risk factors, with shared regional factors, mobility, strength, motor control, altered force distribution, tissue tolerance, key training constructs must focus on shared trainable constructs consistently identified across the hip lumbar pelvic complex: mobility, hip strength, and motor control. Specific exercises Short's team says should be done when monitoring exercises such as local hip and trunk strengthening, adductor side plank, functional exercises, example lateral lunge, and basic compound movement motor control, example triplanar single leg tasks. Active assisted mobility exercise with considerations for individuals' hip and lumbar pelvic morphology. Setting up goals and priorities are key, according to Short. Setting up goals and priorities are key, according to Short. Achieves less injury because it achieves less injury and relies on adequate volume and adherence of training. An adequate baseline and minimal effective dose of exercise must be determined. This includes monitoring objective data. Strength load metrics must be used for secondary risk reductions to make real-time programming decisions. Short's team believes trainable constructs have been consistently identified across the hip lumbar pelvic spectrum. Targeting them appropriately could have mediating effects on past and or future injuries. By focusing on these factors and treating each individual with respect to their sporting demands and the body's specific natural adaptations, it may be possible to develop clinical guidelines for hip pelvic lumbar injury reduction similar to what has been done regarding ACL prevention. As evidence-informed recommendations have been globally applied to comprehensive knee injury reduction with further development, the same could be done for Hagi. The nature of global training principles may result in significant similarities between these programs, which is to the benefit of their application. They also advocate for a systematic, integrated institution, one that requires creating integrated institutions and avenues in all levels: youth, collegiate, semi-professional, and professional, and geographical locations, including the United States, to advance the practical evidence-based science. Education assessment, exercise, movement training, appropriate mobility intervention, optimal dosing of intervention, and continued monitoring have all been commonly recommended in the comprehensive management of various hip, joint, osseous, and soft tissue related injury. This call to action can begin by proactively implement current evidence-based. This call to action can begin by proactively implementing current evidence-informed interventions, such as global exercise programs with injury-specific construct modifications within diverse sporting populations. Assessing the residual outcomes and modifying programs accordingly could reverse trends of increasing non-contact injuries in understudied populations.
Yeah, I mean, I think the most important actually part of when anyone comes in is the subjective portion, listening to asking questions about when do they feel the pain or discomfort. That'll give you so much insight. If someone says, it mostly hurts when I get in and out of the chair, well, one of the easiest things to do is just watch her get in and out of the chair, and you can see maybe that would be more of a functional testing method. But on a more, on a more formal base, we'll look at active range of motion, passive range of motion, muscle length testing, and also strength. They all kind of work together, and that'll help figure out exactly what we need to target. It's really important to think of the body as a chain. So if someone's coming in with foot pain, maybe the mobility or flexibility restriction is actually up in the hip, right? So it's looking at the whole body and looking at range of motion throughout the system.
Well, whenever I have any clients come in, we're gonna kind of assess where they're at in terms of their flexibility and mobility. Given that I'm working with the general populace most of the time, I'm getting folks of all walks, whether working at a desk or not at a desk, working their jobs or previous injuries. So each person coming in using our screening, we come up with some of the mobility and flexibility program we're going to do. Because the first thing we're trying to do is we're trying to create some balance within their bodies. So we are going to prevent injuries going farther, or the idea that if you're slipping and fall, you've braced yourself a little bit better, and those types of ideas. On top of the fact of our everyday movements that we try to incorporate and our balance challenge throughout our programming, no matter where they are in terms of their scopes and their workouts, we're always going to have the idea of injury prevention, even within our workouts. For myself, I will drag out as much as I can out of an exercise before enhancing the exercise, because I'd be so much more on the caution of preventing an injury, because either they just weren't aware of what they're supposed to be doing, or possibly that their body just isn't ready to grab onto that movement. With that being said, most of the time, training folks to try to help prevent injury with their flexibility and mobility, I will make sure that the things that I'm doing with them, albeit to grow into other exercises or to challenge them so they get stronger, bigger, better, faster, stronger, that I'm making sure that the nuances of some of the movements that would be bigger, better, stronger are being touched upon. So when those are called upon, even though they're not used to the movement, their muscles are active and ready to do things that would prevent even injury, never mind in the exercise, but kind of outside my scope.
Awesome.
In respect to the interventions and goals supporting the thoracic shoulder complex and knee complex, as well as the whole human movement system, the ultimate goal is not just sports performance, but lifelong musculoskeletal well-being. Identifying the flaw and fixing this epidemic is what stakeholders are called to action to do. The intense lower limb focus is consistently defended from a Unitarian perspective using evidence of successful outcomes, despite the fact that research extrapolation has substituted specific investigation into shoulder injury prevention. These recommendations were developed from a disproportional lower limb research focus, ignoring the unique characteristics of the lower limb. This intense lower limb focus is consistently defended from a Unitarian perspective using evidence from successful outcomes. Nevertheless, the risk and burden associated with shoulder injuries necessitate a more specific and rigorous investigation. Contemporary research advocate injury reduction strategies such as role adaptation, neuromuscular training, and equipment modification for at-risk populations, particularly active youth adolescents. Interventions must happen during school years because this is when lifelong habits and attitudes are established. These interventions are particularly important because it is during the school years that children begin to establish habits and attitudes that will persist throughout their lives. Coaches and clinicians need a unified framework that provides insight into optimal components of a successful athletic development program, distinguishing between the dosage required for childhood versus adolescence. Education professionals and parents need training to correct postural habits in daily activities. Training programs for education professionals and parents can prepare them to correct students' postural habits during daily activities. In addition, health education initiatives can be designed and implemented focusing on identification of risk factors, preventative strategies, and postural exercises for students. These recommendations were developed from a disproportional lower limb research focus, ignoring the unique characteristics of the lower limb. A systematic review from 2014 performed an analysis on which components of exercise prevention programs prevented lower limb injuries. 17 out of 25 studies included, 8 investigated all injuries. However, no included study focused on shoulder specifically, and very few contained specific upper limb exercises. Additional evidence is required to endorse the generalizability of exercise effectiveness to reduce shoulder injuries as inferred in the studies evaluating all injuries. In a 2018 systematic review, research team investigated shoulder injury risk factors and prevention in overhead sports. The study limited the inclusion population to overhead athletes. Literature on whether exercise interventions can reduce shoulder injuries, and if so, which specific elements of the program reduce the proposed effects, is unclear, which leads to contradictions within the performance community. High-quality systematic reviews currently propose strength training as superior or at least essential compared to all other components of injury prevention programs for injuries in general and to the lower limb specifically. The effectiveness of this generalized advice for the shoulder is unproven.
It's kind of a yes to that. So when they come in with their PARQ, I'm going to read through all of our PARQ questions, provide us with some precursors to what we might see in the movement portion. Never mind what they're going to tell you about, whether it's the previous injuries they've written about or just currently what's going on. Never mind being here in Connecticut, basically the insurance capital of the world, self-proclaimed or otherwise. There's a lot of desk work. And so automatically knowing when they're coming in, as soon as they say I work in insurance, or I work in financial advisement, or I work in Hartford, I'm going to also have that in the back of my mind, understanding that I might be sitting in front of somebody that's 57 years old, that's been at their job. We're like, how long have you been at your job? I've been working with, Aetna for 15 months. Okay. Understanding that I'm going to have some of those precursors going into the workouts, understanding of what we all understand about sitting positions, office chairs, meetings, and I'm going to look for those things as well. So all of that is encompassing in what I'm going to do coming into the physical portion of, say, our orientations and our evals. But that'll only be what I'm looking for in our evals. The majority of our evals are, I would give it like 80% of our evals are set in stone. The other 20% is either what I'm looking for or some nuance I'll do to the portion of the eval, because one, I'm going to take injury into account, their actual exercise prowess currently, and their physical stature currently. So you mentioned the overhead squat, I might modify that into pieces so I can see the shoulder joint movement and the hip movement, because I can, standing off of what they told me, I would be on the cautionary side of trying to get both of those to work together. Right. Okay. Not seeing them move at all besides walking to the desk. Okay. Which, with all the stuff that we do as trainers, after a while, someone walking to you, you would hope that your eye is trained to see like you already noticed their gait. Right. Right. Which is a big part of our orientation, which the very first thing we do is we take them, we have them walk down this very room, and we joke. We're like, don't I want you to walk as normal as you feel, and unfortunately someone is staring at you.
Yes.
And just walk straight ahead a couple times, and that begins to give us that gait. And evaluating that going forward gives me some of the other ideas of where our eval is going to go, but it's always going to have those nuances within it because it's such a majority of the folks will hit some of those. It's just whether or not that overhead squat is performed without the overhead spot, and I just got to figure out how to see the shoulder joints work on their own, just because I'm worrying about their posture.
Yes.
The proposed solution: a systematic review and framework are needed to provide new and thought-provoking information furthering recommendations for prospective studies in the field. Key interventions, goals, and priorities for the systematic model highlighted by Stewart's team that can work as a starting framework throughout the whole athletic developmental spectrum and across all sports are: 1. Summarize the available evidence on kinetic point injury prevention in sport. 2. Provide estimates of accurate injury versus overuse essential for tailoring. Overuse injury is defined as a repetitive microtrauma over multiple events, acute injury in a singular sudden traumatic event. 3. Categorize the different types of exercise interventions found in injury prevention programs to identify effective components. 4. Describe and categorize the components of injury intervention programs into open kinetic chain exercises versus closed kinetic chain exercises. Describe and categorize the components of injury intervention programs into kinetic chain exercises versus closed kinetic chain exercises. Improve the quality of the studies. For example, higher CAT scores, lower grade risk biases. 6. Use standardized assessments addressing the issue of different measurement methods for the same construct. 7. Minimize confounders, specifically controlling for participants' experience, injury history, and weekly running mileage. 8. Achieve homogeny. Consistent reporting is needed about injury severity, the course of treatment, previous injury, and whether the athlete sought healthcare assistance. Resources and components needed to support athletes and stakeholders to follow this systematic model must investigate the effectiveness of all exercise interventions grouped into 6 tailored categories: strength, stretching and flexibility, mobility, plyometrics, balanced and proprioception, multiple components of exercise. This method for identifying those at risk for future injuries is necessary in clinical or community wellness settings. Policy recommendations will allow the synthesis of clinical assessments. This is necessary to assist clinicians who commonly use standalone findings from single cross-sectional studies to evaluate risk. The resources needed are prospective cohort studies that adhere to standardized protocols to move the evidence base from very low quality to something actionable for a systematic model. Therefore, the ultimate goal of having alterations in objective musculoskeletal clinical assessments that predict whether an athlete is at risk of injury might potentially form the basis of long-term prevention strategies. This directly addresses the need for a systematic model to preserve musculoskeletal health. Future studies should aim to improve the quality of the studies as well as use standardized assessments and minimize confounders when conducting clinical research to prevent injury in athletes.
We want any kind of decision makers that would provide us the opportunity to work with any age of individual, to incorporate what we feel as, fitness professionals, kinesiologists, about how we're passionate we are about the importance of movement. It becomes back into that window of opportunity and specific. If I was talking to them and if I was seeing in my door coming in all the time, as I made the comment earlier about being in Connecticut, insurance capital world, everyone's sitting, I would want to bring numbers here and research it on particularly hip and pelvis mobility issues and whatnot. But a lot of those folks are going to try to figure out how is that going to improve the people that are influencing their agencies, maybe their political office, and then come to them with the idea like a workshop, because draw back into it. They're like, great, that sounds awesome. That's really going to help that populace of 40 to 59-year-olds feel more energized, feel better at work, less healthcare issues, less drain on that, because that's where those folks are probably looking at. How is that going to improve them? On the other side of it, how do we draw in those folks to come into those workshops? Those workshops will have to then be very specific. Like, you're going to come in today because do you have general back pain whenever you're at work? Or coming up with some creative way, because you're going to have to now really stimulate that person to be interested in what you're talking about, exercise and movement, because they are an adult who are doing all sorts of things around the world. You have to now generate even more importance to why it's to take the time to understand why this movement and exercise is important. That's why I feel that when they're young, and stimulating that all the way through the spectrum of their lives, that exercise and movement is important. We have much better of a chance for those people to be like, oh, I remember when I was in my 30s and exercising, and now I'm starting to feel it in my late 40s. I need to go back, and I know it was important, and I need to find the time because that was important to them, versus all of a sudden that stimulus by the time it was then, and they just been working in their office and they haven't been exercising any other way. That's a harder draw in to those workshops in those things where the agency would have to be like, how is this impacting all of the people that my agency or my office would impact, not just kids. Okay, does that make sense?
Or the demographic would be bigger.
So you have to go in and be like, I'm targeting this demographic because I've seen these stats
in this area of the region that's important to them. Because the agency is only, is it a national agency? It seems like we were talking about this if I was walking to my representative, if I was walking down the street to an agency that would have much more of a local impact.
Right.
I need to come into them understanding that my drive for improved movement, exercise, mobility, and flexibility is important to their agency because it impacts the individuals that their agency receives or helps.
Addressing the epidemic of non-contact injuries caused by the lack of a systematic flexibility and mobility performance regimen requires a unified approach. Therefore, stakeholders must adopt a systematic model of specifically tailored mobility and flexibility conditioning to preserve the musculoskeletal health of athletes across the entire developmental spectrum. This research demonstrates that without coordinated intervention, preventable injuries within kinetic chain regions, particularly the hip, lumbar, pelvic complex, thoracic and shoulder complex, and knee complex, will continue to limit athlete performance and increase long-term physical burdens. The evidence reviewed highlights that current practices are fragmented, often relying on weak predictive measures, inconsistent screening protocols, and siloed data systems that fail to inform comprehensive injury prevention strategies. As shown across the pediatric, adolescent, and adult populations, targeted flexibility and mobility training can improve joint range of motion, enhance postural integrity, and mitigate biomechanical risk factors when implemented with adequate structure and volume. The research also makes clear that movement health is influenced not by environmental, psychosocial, mental/social, and the educational variables, underscoring the need for a model that brings academic research, institutions, clinical offices, community stakeholders, and athletic industry policymakers. A unified system supported by valid screening tools, integrative postural assessments, and evidence-based conditioning routines would improve consistency across all levels of play, from early childhood sports through professional athletics. Such an approach would equip coaches, clinicians, parents, and institutions with a shared framework capable of reducing non-communicable injury risk while promoting healthier developmental trajectories for athletes. Ultimately, adopting this systematic mobility and flexibility regimen is not simply a performance enhancement strategy, additionally, a public health imperative essential for safeguarding the long-term integrity of the human movement system.